Today, we are going to teach you how to use your face to diagnose the internal health of your body. But before we begin, I need to share a word of caution. How can I put this? You really do not want to start diagnosing your friends, family, or especially your spouse using the information I'm about to share. The worst thing you can do to other people is point out their health issues, unless they are paying you in a professional practice setting as I did for 30 years, or unless they specifically ask for your opinion. So use this information strictly for yourself. The last thing I want is for you to approach your spouse and say, "Hey honey, I just learned why you have a round face, bags under your eyes, and scaly, rough skin," and then drop Dr. Berg's name in the same sentence. That is a terrible idea. Don't do it. It is bad manners, and you are simply asking for an argument. Keep this information focused on your own health. All right, let's take a look at what is going on here. Let's say you are experiencing balding. Usually, hair loss on the top of your head indicates an excess of DHT. DHT is a very potent form of testosterone that builds up when a specific enzyme converts regular testosterone into DHT at higher rates than normal. What you want to do is reduce the activity of this enzyme by taking certain natural inhibitors. Inhibitors found in pumpkin seeds, green tea, and zinc will help lower this enzyme to reduce DHT. I have a lot more detailed information on this, but today I am providing a high-level conceptual overview rather than granular specifics. Next, if you are losing the outer portion of your eyebrows, that points to a hypothyroid issue, a sluggish thyroid. You might need to introduce some iodine into your routine. Moving on to bloodshot eyes. This is typically a liver problem. Now, it could mean you were drinking the night before and are dealing with a hangover. However, if it is chronic, it is usually something liver-related stemming from your diet. I noticed in my own past a long time ago when my diet was poor and full of junk food that my eyes were constantly bloodshot. Bloodshot eyes signal stress in the liver. However, if you notice redness specifically on the inside of your eyelids, it can also point to a blood sugar issue from consuming too many carbohydrates. I used to experience that as well, and it can actually feel like sandpaper. So if there is irritation on the inside of your eyelids, suspect an underlying insulin problem such as insulin resistance, or that you are pre-diabetic and heading in that direction. I am also going to cover what causes dry eyes in just a moment. Let's move on to dark circles under the eyes. If you have these hyperpigmented dark circles, it is a pigmentation issue stemming from insulin resistance. A lot of diabetics experience this along with darkened skin in various body folds, such as the armpits and around the neck. This happens because high levels of insulin directly impact melanin production in the body. If you have dark circles under your eyes, what you need to do is transition to a healthy keto diet and practice intermittent fasting to help reverse this insulin resistance. Now let's flip right over to bags beneath the eyes. If you notice swollen tissue under your eyes or even above them, this is either another blood sugar issue or an indicator that something is going on with your kidneys. High levels of sugar destroy the kidney more than almost anything else. So again, it ties back to insulin resistance as the kidneys take a massive beating from a high carbohydrate diet. While there are other causes of kidney issues, when the kidneys back up with fluid, it shows up as swelling directly under the eyes. Let's walk through the issues on this side. Oily skin means your sebaceous oil glands are overproducing oil because your androgen levels are too high. If you are male, you need more zinc to help regulate your estrogen levels. If you are female, you might also need more zinc, but excessively high androgen levels usually indicate polycystic ovarian syndrome, PCOS. You might also experience additional symptoms like facial hair and acne, both driven by elevated androgens, which in turn are driven by high insulin levels caused by excessive carb consumption. Are you starting to see the common thread here? A high carbohydrate diet also depletes your zinc stores, allowing androgens to surge even higher if you are female. So a massive number of skin conditions, including oily skin and acne, are directly linked to insulin. Let's talk about cataracts. A cataract occurs when the lens of the eye becomes opaque, preventing light from passing through. The lens is extremely sensitive to oxidative stress. Where does oxidation come from? It can come from sun exposure, chemicals, or medications like steroids. However, a very common driver is a high-carb diet, which is why the incidence of cataracts among diabetics is extremely high. Additionally, if you are deficient in vitamin A, you are far more susceptible to cataracts. When you consume a high amount of carbs without adequate antioxidants and protective mechanisms, you suffer widespread free radical damage and oxidation. This can manifest as peripheral neuropathy in your feet, cataracts, retinal damage, or cardiovascular issues. If you are in the early stages of cataracts, there is a very effective remedy to help reverse the process. Vitamin B1 in its fat-soluble form, known as benfotiamine. Benfotiamine acts as a powerful antioxidant that counters the collateral damage caused by high blood sugar in diabetics. Taking vitamin B1 as benfotiamine will greatly help slow down and potentially reverse cataracts. You can also use NAC drops, a liquid supplement you put directly into your eyes to help defend against ongoing free radical damage. The next issue is red cheeks, such as rosacea or general cheek redness. This is quite common and is frequently seen in Cushing's syndrome. Cushing's syndrome is characterized by high cortisol levels resulting from severe stress, and red cheeks are a key symptom. Interestingly, the standard medical treatment for red cheeks is prescribing antibiotics. Why would an antibiotic work? Because there is clearly a microbial imbalance at play. So why not use a natural antibiotic instead, such as garlic, oregano, thyme, wormwood extract, or sage? There are many herbs that act as natural antibiotics. Following that up with probiotics is crucial. The single best probiotic food is sauerkraut because it supplies both prebiotics and probiotics, though you can also take a probiotic supplement. This approach has proven very effective for clearing up cheek redness. If someone has a grayish or brownish pigmentation on their cheeks, that is a slightly different condition called melasma. Melasma is an estrogen issue caused by taking excess estrogen or being exposed to external estrogens, such as through birth control pills or hormone replacement therapy. It can also stem from environmental exposures to plastics or chemicals that mimic estrogen. If you are dealing with this, you want to take something that opposes excess estrogen or helps clear it out. DIM is an excellent remedy, as it is a concentrated extract of cruciferous vegetables. Alternatively, you can eat more cruciferous vegetables or consume iodine in the form of sea kelp to help rebalance your estrogen levels. Now, what about scaly, peeling, or flaky skin around the nose or inside the ears? What is that? That condition is driven by a combination of low omega-3 fatty acids and high omega-6 fatty acids. Ideally, you want a 1-to-1 ratio between omega-3s and omega-6s, but very few people actually maintain that balance. There is a great test available where a kit is sent to your house. I will leave a link down below where you drop a spot of blood on a card, send it off, and they analyze your exact ratio of omega-3 to omega-6. A huge number of people have a severe imbalance, weighted heavily toward omega-6 and depleted in omega-3. To fix this, you need to consume more cod liver oil or fatty fish. If you have this specific imbalance, you will experience rough, scaly skin, dermatitis, widespread skin inflammation, dry eyes, and dry hair. What foods are high in omega-6? Chicken, as well as foods fried in oils like corn, soy, or canola oil, all of which are extremely high in omega-6s, along with peanut oil. Safflower and sunflower oils are also high in omega-6, but they are slightly better choices simply because they are non-GMO. Still, you do not want to consume them in large amounts. A little bit here and there is fine. Most people simply need to dramatically increase their intake of omega-3 fatty acids. If you are vegan, you can source omega-3s from algae and similar plant sources. Furthermore, nuts, nut butters, like peanut butter, and grains are very high in omega-6 and low in omega-3. This is why grain-fed cattle do not carry the healthy omega-3 to omega-6 ratio that grass-fed cattle do. The same applies to other animals that are naturally meant to graze on grass. Look at typical teenagers. They eat junk food, skip vegetables, avoid fish, and don't take cod liver oil, which leads to widespread skin issues. You will see flaking around the nose alongside oily skin and acne. If they had this knowledge, they could clean it up easily. Man, when I was a teenager, I suffered from so many of these issues and desperately wished someone had given me the right information so I didn't have to deal with it. What we are looking at here are various symptoms and indicators that provide clues, allowing us to pull the thread and see what is actually causing the underlying problem. Unfortunately, if you search these symptoms online, especially on the first 5 pages of Google, you will mostly find pharmaceutical recommendations, medications, and topical creams, none of which address the deeper root causes. Let's discuss blackheads. Blackheads are often a simple vitamin D deficiency. If your vitamin D levels are low, you get blackheads. Get more sun exposure, watch my video on how to make your own vitamin D supplement using sun-exposed mushrooms, or take a high-quality supplement. Next, cracked corners of the mouth. I used to suffer from this and many of these other symptoms in the past. Cracking at the corners of the mouth points to a vitamin B2 deficiency. Vitamin B2 protects the liver from damage and performs many essential functions, but one of its major roles is maintaining skin integrity. A deficiency causes fissures or cracks. These fissures can show up as chapped lips or deep cracks on the back of your heels. A B2 deficiency is almost always caused by consuming too many refined carbohydrates and flours found in foods like bread, pasta, cereal, crackers, biscuits, and pancakes. When you see cold sores, that is the herpes simplex 1 virus. The single best way to push that virus back into latency is to take natural antivirals like garlic or zinc. There is also compelling data showing that periodic prolonged fasting can help suppress certain dormant viruses. The tricky part about viruses is that they linger inside your body in a dormant state, waiting until your immune system weakens to reactivate, striking when you get older, suffer from nutritional deficiencies, or experience high stress. One of the primary stressors that forces viruses out of remission is emotional loss. Sooner or later, we all experience severe loss, losing people around us that we love. That profound stress hits the physical body hard and allows these viruses to resurface. In fact, many autoimmune diseases are similarly triggered by intense stress following a loss. This is an area where you won't find a lot of published information, but in my 30 years of practice, it was nearly a one-to-one correlation. I always asked patients what happened right before their autoimmune disease started or before a dormant virus flared up, and there was almost always a major stress event or loss right before it. Regarding facial hair, as we discussed earlier, in females, this signals elevated androgens, often tied to polycystic ovarian syndrome, PCOS. The primary driver of excess androgen production is elevated insulin. So, once again, the solution is to adopt a low-carb diet and reduce eating frequency through intermittent fasting. As for acne, I mentioned this earlier, in both men and women it is driven by excess androgens. It can occasionally be caused by elevated estrogen, but it is typically androgen-driven, originating from high insulin levels. Other factors can contribute, such as drinking milk, but those are far less common than the insulin issue. To resolve acne, you simply need to eliminate carbohydrates, clean up your diet, and the skin clears up. Acne is a fantastic visual indicator of what is happening with someone's internal diet. I truly wish I knew what to do back in high school when I had severe acne, because dealing with it can be emotionally devastating. For my final point, look at this visual indicator. A round face. I am going to put up a picture from when my son got married. You can see how round the shape of my head was back then compared to right now. That happened because I was eating what I thought was a healthy diet. But that diet included snacking on apples with peanut butter. I wasn't eating total junk food, but I was constantly eating fruit and snacking throughout the day. If you have a round face and want to trim off that facial fat and puffiness while fixing these other internal issues, get on a healthy keto diet, stop snacking, and implement intermittent fasting. If you are new to my channel, I have 2 very simple step-by-step videos that you should watch back to back. I have placed them right here on the screen. Check them out.